All right. Which of the following conditions can cause a hiatal hernia? Increased intrathoracic pressure, weakness of the esophageal muscle, increased esophageal muscle pressure, or weakness of the diaphragm muscle?
Diaphragm muscle.
Good. That's all appendicitis. Okay. Which of the following definitions best describes gastritis? Erosion of the gastric mucosa, inflammation of the diverticulum, inflammation of the gastric mucosa, or reflux of stomach acid into the esophagus? The number 4?
I said 3.
Oh, 3. I thought you said that one.
She said 4.
I said 4, but
This is for gastritis.
gastritis.
Mhm. What would we suspect would be the problem with reflux of stomach acid into the esophagus? What would be
Oh,
the
that
diagnosis?
would be the GERDs.
Good. GERD.
Okay. So sorry, what was number 3?
Inflammation of the gastric mucosa. Which of the following substances is most likely to cause gastritis? Milk, bicarbonate of soda or baking soda, enteric-coated aspirin, or NSAIDs?
NSAIDs.
Good.
A lot of quiz.
That question was?
Mhm.
That's fine. Okay. Which of the following tasks should be included in the immediate postoperative management of a client who has undergone gastric resection? Monitoring gastric pH to detect complications, assess for bowel sounds, providing nutritional support, or monitoring for symptoms of hemorrhage?
I'm sorry, let me repeat the question.
Which of the following tasks should be included in the immediate postoperative management?
Yeah.
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 So hemorrhages, right off the bat, we're going to see signs and symptoms really quick. The nutritional support, bowel sounds, those will all come later. Plus, right after surgery, it takes about 6 to 8 hours for bowel sounds to start coming back. So. Which of the following risk factors can lead to chronic gastritis? Young age, antibiotic usage, gallbladder disease, or H. pylori infection? Perfect.
Let's see.
Okay, which of the following, you guys might not know this, so it's okay if you don't know it, but you'll learn from it. Which of the following factors associates chronic gastritis with pernicious anemia? Chronic blood loss, inability to absorb vitamin B12, overproduction of stomach acid, or overproduction of vitamin B12? If you don't know, that's
It
okay.
doesn't have to do with B12.
Actually, it
Pernicious
does.
is the B12. Wait, repeat the question.
Decrease
The two.
Yeah.
Yes. Which of the following factors associates with chronic gastritis and pernicious anemia?
Mm-hmm.
So that would be with B12. How come?
Because
Like
B12
an underproduction of it.
The absorption, no. Something about vitamin D, no?
I think I used that example the other day in our, so you know how vitamin D helps the absorption of calcium?
Mm-hmm.
So that's kind of the same thing with the stomach. The stomach produces something called intrinsic factor, which causes the absorption of B12, vitamin B12. So if we've got chronic gastritis, then the body isn't producing intrinsic factor. And then we're going to have a decrease in, like, an inability to absorb the vitamin B12. So,
And that would cause pernicious
anemia. Mm-hmm. All right, which of the following definitions best describes diverticulosis? An inflammation outpouching of the intestines, a non-inflamed outpouching of the intestine, partial impairment of forward flow of intestinal contents, or abnormal protrusion from an organ.
Can you repeat the first two? They were so close. I couldn't.
An inflamed outpouching of the intestines, or a non-inflamed outpouching of the intestines.
It's an inflamed,
Inflamed.
right?
It depends. Diverticulitis is inflamed.
Gotcha.
Diverticulosis just means there's an outpouching.
And that one was for which one?
For diverticulosis.
Oh, so it would have been the second one.
Mm-hmm. Which of the following, oh wait, what? Okay, I'm not gonna ask that question actually. Oh man, for all lower GI. Which of the following diagnostic tests may be performed to determine if a client has gastric cancer? A barium enema, a colonoscopy, a gastroscopy, or serum chemistry levels? I'm going to change that to endoscopy for gastroscopy.
Okay.
Yeah. Good. I think it's the same thing. It's just a different name for it. Okay. A client with gastric cancer can expect to have surgery for resection. Which of the following should the nursing management priority for the preoperative client with gastric cancer? Discharge planning, correction of nutritional deficits, prevention of DVT, or instruction regarding radiation treatment? So would it be discharge planning?
No.
Could it be correction of nutritional deficits?
That should be taken care of before though, not like right before surgery.
It is that one. The reason that it's that one is because after surgery, they're going to have part of their stomach that just got taken out. And so they're going to have to change their diet a little bit. They're going to have to eat smaller meals. Pretty much just eat smaller meals. And so you're just kind of like teaching them that kind of thing for what to expect after surgery.
Okay. I guess I was reading it like, what do you make sure you take care of right before surgery? And I was like,
Yeah. Mm-hmm.
it's got to be taken care of before.
That's true. Mainly it's just teaching them for afterwards.
Okay.
Let's see. All right. Care of the postoperative client after gastric resection should focus on which of the following problems? Body image, nutritional needs, skin care, or spiritual needs? Good. Nutritional needs. What is a complication of stomach surgery?
The dumping.
Dumping
Drowning
syndrome. Dumping syndrome. Good.
Drowning in my stool.
Ew.
You're
It's disgusting.
food.
Sorry, all of these are.
That'd be nasty.
Could you imagine? I paid good money for this and it goes straight for nothing.
Which of the following conditions is most likely a direct cause of peritonitis? Cholelithiasis, gastritis, perforated ulcer, or incarcerated hernia?
For gas. For which one?
For peritonitis.
Can you read them again?
Yep. Would cholelithiasis be a direct cause of peritonitis? What about gastritis? Gastritis.
Maybe.
Okay, we'll put that one down as maybe. What about a perforated ulcer?
Yes.
Yes.
For
Good.
sure.
What does that mean?
But it's
That
going
makes-
into the cavity.
He
Good.
had
So it just
that.
ate all the way through all of that tissue where the ulcer was. So like in the duodenum, just ate all the way through the wall of the duodenum. So if H. pylori is causing it, then we've got a bacteria that just goes straight in
Into the bloodstream.
into the
Kill
peritoneal cavity.
peritoneal cavity, which can then go to the bloodstream.